I guess when I got to McDonald's as the chief human resource officer, it became apparent to me that there's some interesting differences of opinion regarding benefits, particularly healthcare. In talking to some of my peers outside of McDonald's, they would almost talk about healthcare as a commodity. Like, I've got to offer it. So there it is.
Welcome to Broken Benefits. I'm your host, Lee Lewis, and this is a podcast where we learn from top employer experts on how to fix our broken benefits to save lives, save dollars, and save your talent. Hello, everyone. Welcome back. Today's guest is the former CHRO of McDonald's Corporation. He was inducted into the National Academy of CHROs and is the current and one of the founding CHROs of the Health Transformation Alliance. Likewise, he's an advisor to UC Berkeley and Laszlo Bock's prestigious Transformative CHRO Leadership Program and is an advisor to the HR Policy Association. So excited to let you get to know him and reconnect with him. Rich Floersch, thanks so much for joining us on Broken Benefits.
Thanks so much, Lee. Looking forward to it.
Yeah. So going right in with many competing priorities, when and how did you become focused on and interested in healthcare as a problem that you wanted to address while you were serving as a CHRO?
Yeah, well, I mean, because I came up through the rewards function, I had some experience, obviously, working with both compensation and benefits. So I understood the importance of both of those areas. And I guess when I got to McDonald's as the chief human resource officer, it became apparent to me that, there's some interesting differences of opinion regarding benefits, particularly healthcare. In talking to some of my peers outside of McDonald's, they would almost talk about healthcare as a commodity. Like, I've got to offer it. So there it is. I'm not sure that really people make big decisions about whether or not they're going to come to an organization because of healthcare. I just had a different point of view. And I felt like, particularly, as you begin to think about people moving through their different life stages, healthcare becomes really important at different stages in their life. And I don't know, I feel like it's a differentiator. And I think that it's a cultural communication, which is we care about you. And, I think that's a very powerful kind of cultural message to your employees. Second thing is, when you work in a restaurant organization, margins are pretty tight, particularly when you think about, McDonald's and its pricing. So any line item that's above inflation gets scrutinized during the budget process pretty carefully, because you just can't automatically pass along above inflation kind of increases to your consumers. So I knew that my peers were going to be looking at me to say, well, how fiscally responsible is this CHRO that we now have at McDonald's? So I picked up how important it was, particularly for a restaurant company.
Everyone, now just a quick word from today's sponsor.
Mom, are you crying?
No, sweetie. Just some allergies. Come here. Let's go play. Come on.
1 in 4 Americans had trouble paying a recent medical bill. Many of these people affected work for companies just like yours. Start giving your employees 100% medical coverage with Catalyze Health.
Not all CHROs, even those at restaurant companies or retailers, are deeply focused into healthcare. I'm curious, acknowledging that your perspective on this was a little different. Were you always that way, or were there experiences that you had that brought you to pay more attention and want to be more strategic with healthcare?
Yeah, I'm not even sure I mentioned this to you when, we talked about joining HTA or subsequent conference, but I've had probably the most unique trigger event
Hmm.
on this than any other CHRO. So I'm going to take you back to when the Affordable Care Act was being, designed. And, when you think about the Affordable Care Act, there were certain things that were used as kind of models of things that the folks who were working on the design of ACA believed were not positive aspects of the current healthcare system. And one of them was mini meds. There's mini med insurance that, a lot of companies in the retail space, even universities, anybody that had kind of low income wage earners, you could
Yeah.
consider the mini med option in addition to offering your current health care, but, it could be a little bit too expensive, for individuals at that segment of the population. So we got a note directed to our CEO saying, we want to talk to you about mini meds at a congressional hearing. And my CEO said, unfortunately, Rich, I'm busy that day. So
Oh my.
you're going to have to go. And it was, let's just say the hearing was not designed to applaud mini meds. The congressional hearing was so anyway, prepping for that, getting in front of a congressional hearing and, really understanding how healthcare can become, a flashpoint for an organization like McDonald's. Even though I had kind of an appreciation for healthcare benefits at that point, it just got tripled, quadrupled. So
Wow.
that experience, I think, really got me thinking, it's not just the way that you think about designing it, but it's how also people might perceive it from the government side. So, and I think, as you know, ACA did away with mini meds, and we worked on a incredible project team to implement ACA, and I actually applaud a lot of the aspects of ACA, in particular, expanding access.
Yeah.
And, I'm very proud of where we ended up. We ended up with a program where we knew that the affordability of offering our benefits program would be based on, how much discount we put into the premium. And we decided 90% of the premium was going to be paid for by the company for our restaurant employees, and 60% was going to be paid for our executives. So we really wanted to make it affordable. And I'm telling you, we had groups of 20 people in the room, senior leaders, because this was such an important aspect for the company.
Wow.
I want to call out my head of rewards, Lisa Emerson, and my head of benefits, Carla Zolby. They were the stars of that project team. So anyway, it's a unique kind of experience when you think about the trigger, but getting in front of a congressional hearing can get you to lose a couple nights of sleep.
What were some of the key problems that you saw in healthcare when you started to be a lot more active strategically and wanting to change things? What were some of the problems that you focused in on that you felt like we needed to try and change for the organization or the country?
Yeah, I'll say the problems and then the opportunities, and I'll be, concise on this one. I mean, cost curve. I mean, everyone knows like I said, any line item in an organization that trends above inflation is going to be scrutinized as it should be. And then the opportunity side is if you design these things properly and, you're fiscally responsible, and there are aspects of the healthcare program that are very attractive, it could be a real important part of your talent strategy. And the other thing I would say is, for restaurant employees, which always kind of grapples with turnover rates, if you offer a really strong program, like I said, discounting the premium by 90%, and making it more affordable, you could actually see reduction in turnover because of why a company would want to come to a McDonald's versus maybe another organization.
Wow. That's huge. Why did you help found the HTA, and what was it that drew you to it?
Well, another Washington experience. So when ACA was being designed again, we thought it would be smart if we took a trip to DC with our government relations folks and met with members of the Treasury Department, as well as staffers from these congressional offices that were very much involved. And one of the interesting ideas that came out of those conversations, and we offered this up, take your ideas, your design ideas, and we will give you access to our restaurant employees. You can do focus groups with them. Find out whether or not these ideas that you're coming up with, because this is the group that they really wanted to target, right?
Yeah.
So we thought it was like, hey, and they said, oh, yeah, great idea, great idea. A few weeks go by. They didn't follow up, send a note. Oh, we need a little bit more time. Another few weeks go by. Crickets. So it became very obvious to me, and I've spoken to some of my peers at the time, that the self-insured employers were really not at the table when the design of ACA was. So I felt like maybe there's another model. And HR policy and its board thought that putting together a cooperative of Fortune 500 companies might be a way to influence the healthcare ecosystem on our own. And between that and the perfect timing of me retiring from McDonald's and going into a startup organization, which I'd never done. So I thought it'd be kind of cool. I didn't really think I'd be almost 10 years. I thought it, might be a little bit more of helping it get off the ground. And I've had to make adjustments, obviously, like a lot of people in startups. I had a staff of 400 at McDonald's. I have a staff of 0 at HTA. But that was probably the thing that most, and I love the mission. I love the duality of managing costs and improving quality of care. So been a great experience.
What are some of the ways that it made a difference to you, or that working with your peers helped shape the way that you engage with the strategy?
Yeah, well, I mean, if you think about some of the things that, people would say pretty quickly that are driving some of the things that, need to be maybe improved with healthcare within the United States, are the things that HTA is focusing on, which is transparency, right? More visibility around costs and quality. Number 2 is high cost of drugs.
Yeah.
That's a big part of the healthcare increases, and our RX solutions, I think, can help companies in terms of being able to manage those costs. And then, there's just a lot of costs that are built in that's both positive and negative. Innovation in the US healthcare system is so strong, but it comes at a cost. And finding out those companies that are innovative, but also are going to be successful, is part of what HTA does. We vet these solutions for our members. So I just think a lot of the areas, and I'll just throw the final one, which is, companies own the data, their healthcare data, and they've had to, get into a little bit of a scrum with some of the organizations that would like to keep the data for themselves. And I know we've been pretty successful, you in particularly, being able to try and get self-insured companies to own their own data and be in a much stronger position to understand where the trend lines are and how effective their programs are.
Pulling that thread a little bit, that obviously getting access to data, pricing, and information necessary to make good business decisions is a major obstacle. What are some of the other underlying problems that are more stubborn that you think employers should be focused on to try and turn things around?
Yeah, well, I mean, there are some things that, are just going to be built into, I think, healthcare. I'll give you one, which is, as Medicare and Medicaid become even more and more expensive in terms of the cost to the society, just because of demographics, right? I mean,
Yep.
what was it? I think 1980, 10% of the population was over 65, and now it's almost 18%. And I think it's gone from 20 million to 60 million people. So that's just a demographic with the baby boomers, as they get into retirement age, is just going to continue to drive the cost. You know, I would say that, as you think about just health and wellness, you think about obesity, you think about diets, um, hopefully some of these GLPs, that are now available are going to maybe bring that back down, some of those numbers, which would be incredible because I think, as many people know, it contributes to healthcare expenses. So I don't know. I just feel like as companies own their data more, and as we get solutions that can provide, just like Yelp does, quality ratings and cost information, hopefully we'll be able to see some plateau. But there are some inherent factors that will continue to drive increases in healthcare.
Yeah. What are the methods that a CHRO or other senior executive uses to transform healthcare? Obviously, you don't have very much time. Often, maybe 2 to 5% of your time can be spent on healthcare because of so many other things. But within that narrow band, what are the ways that a CHRO can become more activist to fix healthcare?
Well, I mean, you said it partially, Lee, which is if you're going to spend 2% of your time in an area where the organization might feel like there needs to be more attention. And, when you're any C-suite executive, where you spend your time sends very strong messages about your priorities. So I would challenge CHROs. Most CHROs don't usually come up through the benefits track. So you do need to rely on making sure that you staff your organization, with experts, but also a diverse group. Think about bringing people in from the finance organization. Think about people bringing either formally into your team or, as part of a project team from legal. And I think a CHRO can be a really good, I call them orchestrator, around key priorities. Get the right people in the room, set the right environment, get the right staff, make sure they've got a strategic sense in addition to being expert, create that diverse team, and then empower people to come forward with ideas and, maybe challenge them to come up with a multi-year strategy versus a one-year strategy. There could be some great ideas that you want to do in year 2, year 3, that you can get buy-in to senior management, and then you don't have to go maybe every year. You could say, this is part of what we agreed to. And I don't know. I think that spending more time in the area of healthcare entire benefits program, I think is well worth. I think the ROI on your time would actually be a positive.
Do you think most CHROs believe that they can make a difference in healthcare, or is it? I do get the sense that for many of them, it's either a commodity that isn't differentiated, so spending time on it is not high yield, or that the problem is just intractable because you can't choose when people get sick with cancer, right? I mean, it happens or it doesn't.
You know, I don't think it's a commodity. I said that earlier. I
Yeah.
think that you can differentiate. I think people are paying much more attention to their healthcare offering, even when they're thinking about leaving a company and going to another company. Um, so I would challenge that supposition,
Mhm.
and I I just think that attend and not just look at some engagement surveys around how people feel about their comp or their benefits, but sit in on some focus groups and listen to your employees talk about healthcare. Whether it's very complicated, I wish there was more communication around it, or geez, I wish they would cover this particular area, or this particular provider I've not had really good experience with. I don't know. I think if you just manage based on surveys without tapping into the employee's sentiment through a focus group, it might actually open your eyes to how your employees think about your healthcare and where you could make changes and
Yeah.
improve perceptions.
If you were advising a senior executive at an organization where the healthcare approach has been kind of just go with the flow, what advice would you give to that executive about how they should start to change things in order to get out of the rut?
Well, think about if you've got the right staff, the right leader
Okay.
on the rewards or benefits side. Number two, are you being clear with where the priorities are? Number three, are you in a position where your benefits team is going to feel like if they take some level of risk, that you're going to have their back? And then the final thing is when they have a really good year and you now have the opportunity to reinvest some of those savings into other areas of the company, other HR programs, put them up as heroes. Recognize them across your entire HR team and at a minimum at the senior level of the organization. And I know we've talked about this, how do you create the right environment so that people can be viewed as heroes? And that's a very strong kind of word, but if you think about empowering your team, making sure you give them support if things get a little bit dicey, making sure that you're the one as the CHRO that ensures that the GC, the general counsel, and the CFO are aligned with your team. I think those are the ingredients that make for, a successful benefits team.
I love that. Looking externally out to providers, hospitals, vendors, et cetera, how do you think organizations should realign the incentives and the ways that they pay so that we can start to realign the systemic incentives out in the industry?
Well, the first thing is I'm a big believer that when you bring a provider on or a solution, you want to get a good price, but you also want to make sure that they are in a position to make some money. So, I don't think you get the best results when you drive the cost down so much that the healthcare provider cannot, generate an acceptable kind of profit. So that's number one. The second thing is just, as we said, Lee, own the data so that you can be in a position to be able to say, here's where we have some opportunities. You've likely already seen these opportunities. We now have visibility on it. Let's put together a plan. Maybe between the two of us, if we can manage these costs down, we can provide a greater fee for you. So share in the results. So I think, and then the final thing is, I would say, set up accountability meetings. Maybe it's every quarter where you and somebody from legal or finance go through all the different solutions. How are we doing on cost? And more importantly, how are we doing in terms of our employees? Are they seeing this solution as effective, this provider? And you combine employee feedback with greater access to data and a cadence around how you evaluate and establish accountability. And I think you can align incentives pretty easily then.
I love that. What what do you see are the biggest risks out on the horizon in healthcare right now that could change the way that employers interact with health and benefits?
Well, I went through the demographics. I went through,
Yeah.
the fact that government is probably going to continue as Medicare and Medicaid continue to go up. They're going to continue to look for opportunities to shift the costs out into the business community as they have been doing historically. I think the one thing that's really kind of popping up, though, big time is just regulations. And, you know, whether it's the government or law firms coming after you, are you providing the right kind of fiduciary responsibility? Are you managing the healthcare program in a way that the employees are benefiting? And I think some of the stuff we talked about regarding accountability, regarding data ownership, a strong benefits staff, I think those are the things you've got to be doing. That's almost the greens fees now, because that's how you could end up getting tripped up from a fiduciary responsibility standpoint.
Pulling the thread on that a little bit, what do you think are the blind spots that we have around kind of the fiduciary management? And I want to think of you were there to see what happened with 401k in the 90s, where that was ERISA law and there was a lot of activity there legally. I didn't have the purview into what the before looked like, what the transition looked like, and after, but using that as a parallel, maybe could comment on where you see similarities.
Yeah, well, the 401k thing was from a fiduciary standpoint was, are you managing, are you offering, your 401k plan in a way that is, it's not excessive in terms of the fees that you're paying, or you're going out and offering different investment vehicles that are not performing at market. So if you think about it, there's some parallels, as you said, with healthcare. Are you on top of it? Are you making sure that the data that you're getting, you're actually making decisions, not just getting the data, but understanding that the insights from that enable you to say, well, maybe this solution is not really working effectively, and we've got to get rid of it and bring another one in. Or now I'm on top of the cost associated with, our benefits, and there's a particular provider. So I think if you did a lot of the stuff we talked about earlier, and you did it in tandem, your best friend as a CHRO is going to be your general counsel and your CFO. If the general counsel is going to give you great advice on the compliance side, and the CFO is going to sharpen the pencil on making sure that the market rates that we see are in line with, or hopefully even, you're trending even below. So I would be very much making sure that this fiduciary responsibility gets shared across the C-suite.
I love that. Do you get the sense, I have spoken to some people in the industry that say healthcare is so big that every company or almost every company has a big business line item that serves healthcare, and that perhaps that creates a conflict of interest where executives see profit coming in one side on healthcare, but also obviously cost on the other. And I don't know if they make that linkage, or maybe that is an extremely challenging I guess, contradiction that they have to work through. But I don't know if you've seen that in your interactions with other lead executives.
Yeah, yeah, and I think it depends on the industry that you're in.
Sure.
I think there are certain industries that probably have that a little bit more. I did not have that, being in the restaurant space at McDonald's, but I could certainly understand a C-suite executive seeing that there's a particular business unit or important line of business that comes up through the healthcare ecosystem that benefits the company, and how tough you're going to be at managing maybe some of your expense. So I do think that that's a particular challenge, but fortunately, I've not had the
Yeah.
opportunity to be able to sit in that chair.
How might we recruit more CHROs to invest more time and energy into building the right staff and giving air cover to a more innovative benefits team, things like that?
Well, I'm going to be a little bit of this is the first time I'm going to be a little bit of a homer on the
Okay.
call here. I really do believe that scale does matter. And, we're at what, 75-ish member companies in HTA. I think clearly on our way to 100. When you start to get that kind of healthcare expenses rolling through the cooperative, the days when, right, McDonald's or other companies went down to Washington to say, we'd like to help on new ideas you're thinking about regarding healthcare, and then kind of being stiff-armed, I think would be over if you've got 100 member companies. So I think being part of an organization like HTA would be extremely important, because the scale does matter in this area. And my goodness, you can just learn a lot from the HTA staff, people like yourself and your colleagues at other companies that maybe open your eyes to some ideas. I mean, we've got some members that have had some terrific results by virtue of being part of HTA, and there could be some great sharing of ideas across your peers. And then, like I said, scale does matter.
Everyone, now just a quick word from today's sponsor.
The Lockbox is a place where all of our customers' healthcare benefits data is brought together into a single location that allows us to then extract insight and have repeatable value built on top of it. There's so many different pieces of information that are floating around out there that it can be hard to know what's the important elements to pay attention to and what's the underlying noise that's in the data. So what I think we do that's really critical is we help bring our expertise and our experience in modeling to help our customers understand where the real value is that enables them to make the best decision for their member population that they support. For the first time, there's a commonly understood, centrally located data model that all of your different data sources can live, and that you are able to trust the quality of, to trust the security of, and ultimately to trust the insights that you're going to get out of the data that you have.
As you look to the future, if you could shape it and highlight some of the desired outcomes that you'd love to see happen, what would those be in the next 3 to 5 years, both with HTA but also healthcare in the country?
Yeah, I think, boy, if we could ever unlock, this thing about transparency between cost and quality. If we could somebody could either figure that out and have a very easy way to be able to navigate through, your iPhone or computer or whatever. My goodness, that would be really important, I think, to the equation. And then as it relates to HTA, how do we keep making sure that we offer solutions that somebody cannot get by their own. You can only get this solution, and it's either cost to you or its effectiveness, because we were able to negotiate a terrific deal on behalf of 75 or hopefully 100 members. So I think things like that are really important. And then, as I think about it, Lee, we've talked about this. How do we continue to make sure that we bring talented and passionate people into the HTA cooperative? And I'm pretty proud of the fact that our staff today is pretty talented, but they're passionate about the mission. And boy, you can't quantify that enough. That really does matter. So I just want to be in a position to make sure as we grow and add people that we make sure that we bring the same kind of talented and passionate people that we've got today at HTA.
Yeah, I love that. What is it that you're doing right now as you're working with other CHROs, et cetera? And if you're open to it, how might people connect with you to learn more or to engage on other issues?
I'm very, easy to track down. You've got R. Floersch, at htahealth.com. You can certainly reach out to me that way. I'm really in a position right now where, between working with HRPA, between working with HTA, I love the fact that we're collaborating on the training programs. So we've got some really great training programs. Shelley Carlin's done a great job of designing them. You're a great part of the faculty. And there aren't that many healthcare training programs out there, that are taught by practitioners or experts like yourself. So I love that piece of it. And the work that I continue to do with HTA and the coaching that I do with new CHROs. Benefits may not be the first thing that they think about when they become a new CHRO.
Yeah.
But, maybe executive comp, because some of that goes up to the board.
Mm-hmm.
But I would encourage any CHRO to think about the type of information they share with their senior management and board. I do think that sharing benefits information and not just executive comp, you can get some really cool feedback from your board, and I don't know, just establishes a whole new level of accountability, which usually makes people better.
That's interesting. What if we were to zoom in there, what additional information do you think ought to be shared? Is it financial or outcomes, or I'm trying to think of what information would really cross that boundary well?
Well, because of how important the decision was in terms of how we were going to design our healthcare for our restaurant employees, we actually, not to the same extent that we did with our senior management team, but we actually walked them through over the period of 6 months, over a couple meetings, what our plans were for how we were going to, provide healthcare to our hourly restaurant employees. And I don't know, I think to the extent that the board can get a better understanding of not just the programs, but why you're doing certain stuff, that supports either some attraction, retention objective, indicates an opportunity where you can save some money and reinvest. I think those things are, board members sit on a lot of different boards. And a lot of times they pick up things from either a McDonald's that they share elsewhere, or they share from their company or their boards, that can be helpful. But I don't know. I feel like in this day and age where a company's culture is so important, but can be a little bit difficult for a board member to understand and calibrate against, some of the conversations you have about your benefits programs do indicate some of the things that you're trying to establish as a culture. So
Hmm.
to the extent that you can do that, I think it gives the board members maybe a little bit more information and can give you feedback on things that maybe you could do differently.
I love that. And even as you're speaking through here, that you made healthcare so much more affordable for entry-level workers, for instance, at a 90% value versus a 60%. And other things like that, those are just numbers, but they do communicate value. And they communicate that the organization's thinking about the rank and file versus the executives in ways to try and make the benefits holistic and valuable. How do you think a total rewards team that has never tried doing this before could quantify and tie in the healthcare benefits program to their turnover? What would be the process to extract that information?
Yeah. Well, listen, there's a lot of really good heads of rewards out there. I mean, through HR Policy Association on the Center on Executive Comp, I've had the opportunity to get to know a lot of heads of rewards, and there's some terrific rewards folks out of there that can give me some great insights as well in terms of how to do things differently. But boy, in the restaurant space, or I'll call it retail space,
Sure.
you quantify the cost of your turnover, right?
Yeah.
If you've got 100% turnover, that means you're turning over the entire staff in your restaurant in a year, right? You know how disruptive that is for a general manager of a restaurant?
Seems
There's a strong tie-in between restaurant results and turnover. So the training costs, whether it's Hamburg University training that they've got to take, whether it's shoulder to shoulder training, there's a cost to that. And there's a cost to get up to speed. So if you could take, we'll call it 100% turnover down to 60%, and one aspect of that is because you're doing something different than other retailers on healthcare, and you do focus groups and employee surveys, you can begin to quantify the impact. Maybe not to the dollar, but directionally around what type of savings that you're having.
wow.
And talk to the general managers of the restaurants. They'll tell you about whether or not the turnover is helping as they begin to onboard new people and talk about the benefits program. So, and you could do that in any industry, but retail tends to be one where you've got some turnover numbers that if you drive them down, you could really see some very important savings.
Yeah. And I'm even thinking at the other end of the spectrum, healthcare is notoriously struggling to retain nurses, that there's a lot of
Yeah.
churn in that area. And in highly technical fields, you might, if you're a large company, employ 1,000 PhDs in one area or another, and being able to hold on to that accumulated knowledge is so critical. I love this as a concept that if you can find a way to take something that everyone else thinks is a commodity and turn it into something that is highly differentiated and a strategic, it creates enormous strategic advantage for the organization.
You're spot on, Lee. I mean, really, that's and I love that idea about nursing too, because there are real shortages of nurses and physicians, that are being forecasted. And how do you create? And I think some of this, unfortunately, was partially by the pandemic and the working conditions that a lot of those folks felt during the pandemic. But my goodness, if you can create a stronger employee value proposition for those occupations, maybe more people will go into it. Maybe more people will stay with it. And I do think benefits and healthcare is not a commodity. Is absolutely a way to differentiate your offering. And again, like I said, what message are you sending? I care about you. That has value.
It's a terrific place to wrap up for today. Rich, thank you so much for joining us here on the podcast today and for sharing all these insights. And for everyone listening, thank you so much for joining us on today's episode. And if this was as valuable to you as it was for me, please consider sharing it with friends and colleagues who might be able to benefit from it. And we'll see you next time. Thanks for joining us on Broken Benefits. If you enjoyed today's episode, please subscribe to our YouTube channel or on your favorite podcasting platform. Also, please share today's show with a friend or colleague. It's free to do, and it helps us spread the message to as many people as possible. Until next time.